A bill aiming to expand mental health services proposes parity for payment of telehealth services in the CNMI.
I think it's just an additional resource to help support the mental health process here in the CNMI.
Saipan House lawmaker Malcolm Omar introduced the legislation which seeks to ensure the public is able to afford those services by requiring private payer, Medicaid, and other government plans or policies to provide coverage on an equal basis as in-person services for CNMI residents.
So this is just like an added layer. So our people or those that need this kind of service can avail to it that's not available on island. I believe here we only have about 3 providers or 4 providers, but it's very limited, and I think the caseloads that they're looking at is like over 100.
He said it's likely to pass the House at the next session.
I've discussed it with my colleagues and also with public comment sections when it was introduced. We had a lot of support. We had from the private sector and also just from the public in general coming in to voice support for it. With mental health support, we want to stress the importance of it because it really affects people, to a point and stuff. But we have to always make sure, self-care and taking care of yourself, that's our priority, right? Our mental health is also our physical health, our well-being. But since COVID and everything, times are, it's like a drastic change.
He said the legislation is meant to augment services already provided by the local crisis hotline and community guidance center at the Commonwealth Healthcare Corporation. Thomas Manglona, KUAM News, Saipan.